Oral care. Equipment. 1 toothbrush. 2 sponge-ended swab. 3 toothpaste. 4 cup with water. 5 emesis basin. 6 towel. 7 mouthwash. 8 dental floss. 9 padded tongue blade. 10 petroleum jelly. 11 suction catheter. 12 gloves. Oral care for conscious. 1 provide privacy and explain the procedure to the patient. 2 close windows and room door. 3 wash hand and wear gloves. 4 help patient to a sitting position. If patient cannot sit, help to a side lying position. 5 place towel under patient's chin. 6 moisten toothbrush with water and apply small amount of toothpaste. 7 handle toothbrush to patient and brush patient's teeth as following. A. Hold toothbrush at a 45-degree angle to the gum line. B. Using short vibrating motion and brush from the gum line to the crown of each tooth and gum are cleaned. C. Cleans biting surfaces by brushing with a back and forth stroke. D. Brush the tongue lightly, avoid stimulating the gag reflex. 8. Have patient rinse mouth thoroughly with water and spit into emesis basin. 9. Remove emesis basin and set aside, then dry patient's mouth with washcloth. 10. Floss patient's teeth as following. A. Cut 10-inch piece of dental floss. Wind ends floss around middle finger of each hand. B. Using index fingers to stretch the floss. Flossing removes particulate matters trapped and move the floss up and down around and between lower teeth. C. Using thumb and index fingers to stretch the floss. D. Repeat procedure on upper teeth. 11. Have patient rinse mouth thoroughly with water and spit into emesis basin. 12. Remove basin and dry patient's mouth. 13. Remove and dispose of supplies. 14. Help patient to comfortable position and hand wash. Oral care for unconscious patient. 1. Place patient in a side lying position. 2. Place towel under patient chin. 3. Place emesis basin against patient's mouth or have suction catheter position to remove secretions from mouth. 4. Use padded tongue blade to open teeth gently. Never put your fingers in an unconscious patient's mouth. 5. Brush teeth and gums directed as previous using toothbrush or soft sponge-ended swab. 6. Swab or suction to remove pooled secretions. 7. Remove basin and dry patient mouth. 8. Apply thin layer of petroleum jelly to lips to prevent drying or cracking. 9. Remove and dispose of supplies. 10. Help patient to comfortable position. Wash hand.
Thumb and index finger, and rocking it so that the back of the denture is dislodged. If that doesn't work, you may have to break the seal by pulling down along the side of the denture.
They're dentures, and we've put them in the denture cup with the lid on it, and we've doffed our gloves, and performed hand hygiene. And now we're at the sink area. So first, what I like to do is I like to prep my sink area because I don't want any of my supplies to become contaminated. So since we're going to be turning the faucet on and off a lot, we're going to put some extra paper towels there so we can just not contaminate our gloves, and we can use the towel to turn it on and off. Then we're going to lay down a towel in this area to help protect our supplies. So let me be doing that. And just lay it down nice and neat. And what we're going to put on it is our toothbrush with our bristles up, our cleaning paste, some extra paper towels to dry the basin out with, our basin, of course our dentures and our denture cup, and our gloves. Then we're going to prep the inside of the sink. This is really one of the most important steps you want to take when you are cleaning dentures. And what we're going to do is we're going to create this like cushion in the bottom of the sink, because just in case if you drop the dentures, and let me tell you, from cleaning lots of dentures, they become slippery and they can easily fall out of your hand. So what we're going to do is we're going to just lay these towels down in the sink, and then we're going to turn on our water. But first let's pull the stopper and then just fill it up halfway with water. And again, this just provides a nice cushion just in case those dentures were to fall into the sink. Okay, and it's about halfway, so we're going to go ahead and turn the water off. Now we're going to prep our toothbrush. And again, you want to use like a soft bristled toothbrush, or check with your patient or your supplies and see if you have a denture cleaning brush, which is specifically made for cleaning dentures. And we're going to use some cleaning paste. And I know a lot of hospitals, you may only have access to regular toothpaste. You can use that, but just keep in mind that regular toothpaste can be abrasive to the dentures if they have whiteners in them. But we're going to use a cleaning paste, and we're going to put it on our toothbrush, just like how you normally would your own toothbrush at home. And put the cap back on the toothpaste. And set our brush down for a second while we get everything else prepped. Now we're ready to clean the dentures. So what we're going to do is I'm just going to rearrange the supplies just here a little bit. That up here and put our basin here. And what we're going to do is we're going to don our gloves, because anytime you are touching dentures, you need to always wear gloves to protect you from getting any germs from the dentures, because the mouth has a lot of bacteria in it. And we're going to turn our water on warm. We don't want it hot because it can damage the dentures, and we don't want it too cold because it really won't do the job. So we're going to turn our water on warm. And we're going to get our dentures, and what we want to do first is we're going to rinse them off. We're going to put them in the kidney basin because we want to clean this denture cup, so we'll have a nice clean area for the dentures to be returned to. So grab your dentures and hold them firmly, and then just rinse them. Put them in the kidney basin. Do the other set. Rinse them off in the kidney basin. Now we're going to rinse our denture cup. And notice how dirty it gets. You want to make sure you get all that out of there, because we're going to fill it a little bit up with water, just enough water to cover the dentures. And why do we want to do that? Well, we want to do that so the dentures are kept moist, because it'll be easier for the patient to put them back in, and it'll help them keep their shape. Now, you always want to ask the patient what they use to soak their dentures in, because some patients use half of a solution, like half vinegar and half water, or a tablet solution. So always ask them that. Now what we want to do is we're going to start cleaning the dentures. So we're going to get our toothbrush, and we're going to start inward and work our way outward. And see, rinsing helped remove a lot of that. But you have to watch out, because down in the gum line, you will get a lot of paste, because a lot of patients use paste on their dentures, and food particles, and that's just a nasty reservoir for germs and bacteria to get in. So make sure you really clean that area very good. And then looking at the front of the teeth as well, getting that, because food particles like to get in there. No one wants anything in their teeth whenever they put their teeth back in. So you want them nice and clean. And then flip them over and get up where the palate part would be as well. Okay, and then we're going to rinse those. And once you get them nice and rinsed, we put them in your denture cup. Now we're going to clean our bottoms. And again, we're going to follow the same way we did with the other ones. Clean inside that gum line really good. And make sure all the bacteria and food particles and everything's removed. Then brush on the back teeth and the front teeth, molars, just like how you would brush your natural teeth. Getting inside where the tongue would lay. And then rinse. And then return to your denture cup, which has water in it. And we'll put the lid back on the cup. Now what we're going to do is we're going to rinse our toothbrush and our basin. Get that cleaned. And we're going to get the toothbrush and really rub your finger, your gloved finger over that toothbrush to get all the food particles out and the toothpaste out. Get it nice and clean. And then I like to take a paper towel and just dry that basin out. Get that toothbrush dried as well and just put that back in there. And then turn your water off. Don't forget to pull the stopper.